Well, with warmer temperatures slowly but surely returning, more kids will start to play outside, and doctors are preparing for the rush of injuries in children. One of the common sports injuries doctors see is with baseball players. Little leaguer's elbow. CBS 21's Lyra Greenberg explains that and other common shoulder and elbow injuries in this week's Doc Talk.
These injuries are common not only in baseball, but in any overhead sport where athletes are repeatedly using their upper body, volleyball, javelin, and the injuries can be just as serious as an ACL tear in the knee.
The following segment is sponsored by Geisinger Holy Spirit.
When Dr. Callista Kostopoulos Morris sees elbow and shoulder injuries in athletes, it usually stems from the same thing, overuse. In baseball, it's usually pitchers abusing the pitch count.
The risk is these kids play in multiple teams and multiple tournaments, and so they might be abiding by the rule in Team A, but then they go to Team B and they say, oh, they can pitch another game, when in reality it should be a combined pitch count and combined throwing thing.
The severity of the injury can be as minimal as
a muscle strain to a ligament tear of what we call the ulnar collateral ligament.
Or as severe as little leaguer's elbow.
Little leaguer's elbow is what we call it, but they can actually fracture through their growth plate due to overuse at throwing and pitching.
Fracturing the growth plate results in surgery.
If we fracture our growth plate, often we need a screw to go across it to hold it back together. That comes out in children.
Depending on the severity and location, a ligament tear may also require surgery, reconstructing the ligament with yours or someone else's tissue. The recovery, 9 to 12 months. So how do you know when it's time to finally see a doctor?
Morning stiffness of the elbow is a big risk factor, so if they wake up after they've been throwing and they can't extend their elbow all the way, that's a red flag.
If you or your kids are involved in any of the sports that would affect these areas, Dr. Kostopoulos Morris recommends getting an advanced coach that will train you to use your legs and core properly to avoid solely relying on the arm. With this week's Doc Talk, I'm Lyra Greenberg, CBS 21 News.